I'd like to introduce Mr. Ramon Carrasquillo. Ramon is 62 years old. He's been a patient for 13 years, and he's been on testosterone replacement since April of 2007, so that makes this is almost exactly 2 years. What was going on with you before we started the testosterone replacement?
Well, I was having problems walking. I had fatigue. I was getting tired going upstairs, and I had a quick temper, very quick temper.
How much of a problem was the fatigue with the walking?
I couldn't walk a long distance.
How far?
Maybe 2 blocks the most, and I couldn't go up the steps. You know, I was very.
What would happen after 2 blocks?
I was getting tired and very fatigued. You know, so I couldn't really walk a lot. You know.
Any shortness of breath?
Very, yes, shortness of breath and everything. You know, it was just hard to do anything.
This quick temper, how did that show itself?
Oh, well, you know, I have a big family, and my grandchildren's small, and I couldn't deal with them. It was very hard to deal with them. It caused like to play all the time. I just don't have the temper to deal with them, and I just couldn't do it.
So would you used to chase them away, sort of?
Chasing away, yes.
Yeah. You've also told me that you had some problems with depression.
Yes, I did. It was very hard for me to deal with anything, you know.
Hard to deal with anything.
Yeah.
And anxiety, nervousness?
Anxiety and nervousness, yeah, sure.
What about your sexuality?
Was awful, you know. Was not there, you know. Was not to come to. It's not, you know. It's something that people don't want to talk about it, but it was very. It was not there, you know.
Okay, so you had problems with all aspects of the testosterone deficiency.
Yes.
You had the physical and the mental and the sexual. And then April of 2007 we started you on testosterone replacement, and what happened?
Things started changing. My sex life got better. I can walk better. I can go upstairs. I can deal with my grandchildren, which is very important to me, because they're very, you know, that's my family, and I want to deal with them, and that's a very important part of my life. You know, that I don't want to miss. You know, I want to enjoy my grandchildren,
and do you enjoy them now?
I do, very.
So your grandchildren
much.
have become a positive factor instead of a negative factor.
Correct.
Mm-hmm.
Yeah, that's the most important thing right now.
How far can you walk now without any discomfort?
I can walk a lot. You know, I walk every day. I go and walk maybe a mile, 2 miles, and you know I can deal with my life better, a lot better.
2 miles instead of 2 blocks.
Correct.
I think there's a difference there.
Yeah, there's another.
And sexually?
Sexually, it's great. My sexual life is very good. It's great, you know. And
You
I enjoy
come
it.
back to life.
Come back, yes. Then you can say that. We come back to life completely. It's a new life, a completely new, different life. It's very nice.
What about the depression and the anxiety, the nervousness?
Everything is gone. Everything is in the past.
So we have a new Ramon.
A new Ramon, completely.
I mean, the old Ramon wasn't a bad guy. The new one's
this
better.
This one is a better Ramon, yes.
Okay, very nice. It's been a pleasure to see you become younger again. Recently, you went away for a while, and you went down to
Santo Domingo.
Santo Domingo.
Right.
And you didn't get a shot, we calculated, for 10.5 weeks.
Right.
You instead of every 3 weeks, 10.5 weeks passed before you came back for a testosterone injection. And what had happened with missing those doses?
Oh, it was awful. That was awful. Everything was going back wire, everything was going back, and I was really missing it, you know. And everything was going back to the old Ramon, let's put it that way. And I would like to advise people, you know, not to do what I did, not to make the same mistake, and go away, for so long without it, because it's really, really gonna hurt you if you do it. And I don't want it to happen to nobody else.
When Ramon came back that day in February to get the shot after 10.5 weeks, we had planned to do this video then, but we couldn't do it because your mind just wasn't clear enough.
That's
You weren't
right.
thinking fast enough.
That's right. Yes.
You were almost like you were drugged.
Correct. Yes.
Yeah.
That's why I told people, if you start, just keep on it. Don't miss no appointments, and make sure you hear it when the doctor tell you to come in. Make sure you keep your appointments, because very important.
Okay. Thank you very much. It's been a pleasure.
Yeah.